Sunshine, it's our sunshine.
Hello everyone, I am Dr. Vidyasagar Chandankere. I am at Sunshine Hospitals, Secunderabad, and I am the lead consultant Paediatric Orthopaedic Surgeon here. I have been associated with Sunshine since last 5 years. So today I would like to talk and discuss about hip problems in children. We know hip joint is a ball and socket joint, and it's a deep joint, and this is the second most mobile joint in the body. There are many common problems which are seen in childhood and early adolescence, and for sake of making it easy, let me classify into 3 types: 0 to 5 years, and then 5 to 10 years, and then later on 10 to skeletal maturity. What problems do we encounter during this 0 to 5 years? The common problems which are seen in this age group is congenital hip dislocation, and that term is not used now. It's called as DDH, or developmental hip dysplasia. The other problems which can happen in this age is probably developmental coxa vara or congenital coxa vara sometimes, and then transient synovitis hip and septic arthritis hip as well. What is important in this condition is transient synovitis hip is a self-limiting disorder, and probably in a couple of weeks it should subside with analgesics and rest. So it's not much worrisome. So the other counterpart, which is septic arthritis hip, can be quite serious joint infection, and it has some consequences unless intervened and properly managed. Let's go to the next, which is more common during 5 to 10 years, which is called as Perthes disease. So Perthes is a transient condition which is because of temporary obstruction or blockage of the blood supply to the femoral head, which leads to femoral head deformation and later on restoration spontaneously. So the other common hip problem is seen between 10 to 15 years or skeletal maturity is slipped femoral capital epiphysis, as it is called as CFE, and another issue can be a femoroacetabular impingement. So what happens in SCFE is ball of the femoral head separates from the neck, and it could happen with minimal amount of trauma, and mostly these patients have obesity or some underlying hormonal issues which lead to separation of the physis. Thank you for listening to me.
Sunshine, it's our sunshine.